everyone in? Can we start?
We can start.
Okay.
If we're introducing each other, more people will come in.
Sure. So good evening, everyone, and namaste.
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 How are you all doing today?
It's good, only it's too cold in Albany.
That's the reason why I want to get introduced to everyone. I don't know from who is from which place. Just let me see the cursor. So if everyone could put their cameras on and unmute themselves and starting, please introduce yourself, your name, profession, state of residence, and what do you look forward after you learn Ayurveda? As a profession or as self-interest, as a preventive medicine for family? So I would like to know. Good?
Well,
So
since
how about
sorry.
Yeah, go ahead, Indu.
Well, I'm the first one over there, so I'll just introduce myself. My name is Indulata Jayapal, but for short, they call me Indu. And I'm a retired registered nurse with a master's degree in nursing. And I've taken some time off from teaching because I want to study Ayurveda. And the reason I want to do it because of my health and also to help a lot of other people because I work with a lot of oncology patients in the hospital over here. I volunteer in Albany Medical Center every Wednesday and if they need me again. And that was my reason. So I wanted to do it for my own health. I was losing my balance and walking. And I have a doctor, her name is Dr. Aparna Bapat. She advised me, she's treated me with Ayurveda for many years, and she advised me to go and take a massage and to do exercises. So I have been doing yoga, and I've been going for massages twice a month because my insurance won't pay for it. And now I'm walking without a cane, and I have my balance.
That's nice. That's really good. Thank you. How about you, Ivy?
I'm Ivy Baker, and I've had a passion for medicine and holistic medicine, anything to do with health, for decades. So massage is kind of a continuing study for me. I studied Swedish many years ago and European hot stone, and was interested in Ayurveda then, but never had anyone local near me that could teach me. And when I spotted Karen's school, I was very excited that, you know, there was a teacher and leader in the area. Mm-hmm. And I've been, you know, wishing to go to her school for many years and finally made an opportunity. And I'm glad to be with you all.
So you stay in Rhode Island?
I'm actually in Massachusetts.
Massachusetts. Okay. Thank you, Ivy.
You're welcome.
Hi, Susan.
Hi, Bina. My name is Susan Woodward. I'm a licensed clinical social worker with a private practice and a somatic experiencing practitioner. I live in Delaware and down at the beach, so the southern part of Delaware, but go to Florida frequently. It feels like a second home down there right now. But I'm interested in Ayurveda to incorporate it into my personal life, and I'm trying to do a lot of that currently, but also for my clients in my private practice. I work with mind, body now, and it just seems like there's still a piece missing. So I wanted to incorporate it there too, and little bits at a time right now.
Okay.
Yeah.
Okay. Thank you. Hi, Nikki.
Well, I'm coming in and out.
Nikki? Hi. Can you introduce yourself?
I'm Nikki Pashar. I live in Albany, New York, and I've been a massage therapist for about 12 years. I started getting into more natural medicine a few years ago by treating my family. And in treating myself and my family and my clients, I realized that I needed to know how to do it on a much deeper level. And I was studying also traditional Chinese medicine for a long time. And I was coming up with a lot of deep questions and finding those answers here.
Okay. Thank you. Hi, Laura.
Hi, I'm Laura Messier. I'm a research assistant at Brown University. I work in
Research in?
I research in paleoclimate reconstruction. I've always been interested in medicine and science, so I found the program with Karen, and I've always been interested in massage as well, but I really like to have the holistic, integrated approach that Karen's school offered. And personally, I've always been very interested in alternative and holistic medicine because I'm much more interested in preventing, problems before they arise. And I think that for me, the most exciting part about learning Ayurveda is learning how to be in touch with myself and physically and emotionally and spiritually, and so that I can be the best healer that I can be on this journey that I'm on.
Thank you. Thank you for sharing.
Greetings.
Suna, I am not able to see your full name. It starts from OHI, so is it O?
Hi, I'm Owe.
OE, okay.
Yeah, Owe is short for Ohilda.
Oh, Hilda, okay.
Yes, nice
Hi.
to meet everyone. So I live in New York City. I found Ayurveda because I've always been interested in healing. I've taken some green medicine courses, emotional freedom techniques, and recently Reiki. I have been taking some of Karen's classes, so I am certified in Abhyanga through Karen's school. I went to, I met her actually here at the Open Center in New York, and then I also took Abhyanga with her in Costa Rica. I am in education, but I'm also a life coach. I hope to someday be able to bring Ayurveda to my practice, my life coaching practice, and really turning it more into a healing practice and moving a little bit away from life coaching per se. And but I've used Ayurveda for myself, and really I'm looking forward to continuing to learn and grow and be able to understand it a little bit deeper and better for myself and for my family.
Wonderful. Thank you, Wahi.
Thank you.
Who is next? I see all the cameras shutting down, so I'm not able to figure it out. Okay. Nicha. Hi, Nicha. Can't hear you. You have to unmute yourself.
You said. So I'm interested in Ayurveda because some kind of Ayurveda was seem like Thai massage. So and then in this case that I'm start learning and I can use to Thai massage for so slow and breathing a little bit so before I just kind of like work faster, and from now on I kind of like slow down and I think improve it, and then I want to understand more about that. Thank you.
Okay, thank you. Jason?
Hello,
Hi.
I'm from Massachusetts and I'm a student now at the Newport Massage School. And I just always had an interest in Ayurveda and the Eastern medicine and other ways of healing myself. That's why I was interested in a lot of this. I found Karen's school. I like the way how she kind of brought everything together. That's
Thank
why
you.
I'm here.
Thank you.
Bye.
And I think the last one, Abby.
Yes, greetings.
Oh, great.
Too close. My name is Abby. I work at a psychology-based market research firm. I live in, it's really small. I live in seacoast of New Hampshire, moved here from New York City when my boyfriend got a job as a public defender up here. I've, like a lot of other people, I've always been really interested in health, healing, everything to do with the body. I was a gender studies major in college and focused on embodiment in anthropology. So this has always been Ayurveda has always been something I've been interested in, and just alternative healing modalities in general. And I know Karen through my mom, who is a writer and a yoga teacher, and they've done they did a training together in Costa Rica. So yeah, I'm excited to be here.
Okay, thank you, Abby. Okay, so good evening all. We are ready for our session for Srotamsi. And can you all hear me and see me?
Yes.
Yes.
Okay.
I can hear
So
you.
I will request everyone, if possible, you can mute your microphone, but if it is possible, then I would appreciate if you keep your cameras on so that I can see you. Now, if I understand correct, last week you studied about the dhatus, right? No? Have you been introduced to dhatus?
Actually, we had Sanskrit last week.
Sanskrit, yeah.
With Simon.
Have you been introduced to dhatus at all?
Yes.
Yes.
Okay. So you are familiar with Sapta dhatus, that is the 7 bodily tissues. Can someone name them?
Rakta, Rakta, Mamsa, Meda, Maja, Shukra, Artava.
Okay.
Oh, and
Quite
Asti.
well.
And Asti.
Asti.
Job.
Rasa, Rakta, Mausa, Meda, Asti, Majja, and Shukra. These are the 7 dhatus. So when we say Artava, it comes under Shukra dhatu only. Okay. Can someone name the dosha and their subtypes for me today? Just a quick revision. What are the 3 doshas?
Pitta,
Vata, Pitta, and Kapha.
Correct.
Yeah.
What are the subtypes of dosha, Vata dosha?
Subtypes. Is it the sun, the fire, the earth?
Vata, yes, Vata is the air principle, and last month we studied the dosha and their subtypes. So we studied 5, correct?
Yes.
Udana,
Correct.
Vayana, and Apana.
Perfect.
Yeah.
Perfect. How about Pitta?
Panchat, Pitta, Ranjak,
Pacha, Ranjak,
Ranjak, Sadak,
Sadak,
Alochak, and Brajak.
Brajak. Perfect. How about 5 Kaphas?
Tarpaka,
Correct.
Avalambaka, Klaidaka, Bodhaka, and is it Shleshaka?
Shleshak. Correct. Shleshak.
How do you say the last one?
Shleshak.
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 Yeah. So basically these, and do you know what are the 3 types of malas? Can anyone say the waste?
What was the question, Bina?
3 malas. The 3 wastes of our body.
urine, sweat, and fecal matter.
Perfect. So basically dosha dhatu mala moolam hi shariram. That means dosha, dhatus, and the waste mala are the main fundamental principle or the structural and functional unit of our body. So these are the basic things. We are going to learn the strotas today. I'm trying to find my cursor. Okay. So what does Srotas mean? Srotas means marga, that means passage. Okay, any passage from which things are carried from one end to the other end, a path or a channel system. Okay, any system in our body is called as the Srotas. So this Srotas have some Sanskrit synonyms like Sira, Dhamani, Rasayani, Rasavahini, Marga, Kha. Kha means space, that which has space. Sthana, that means which has a position, a place. Ashaya means again which has a space in it. So these are all synonyms for Srotas. So basically Srotas means a path, a passage. Now this passage, our body is full of passages. Right from a single cell also has its own passages. It has a place from where things come inside the cell, and from inside the cell it goes outside the cell, the matter. So there is a cell membrane, okay, that itself is a passage. Then there are so many structures inside the cell, like the mitochondria, the endoplasmic reticulum, the ribosomes. Everything are the structures. These structures are attached to each other by some kind of passage, right? So we are familiar with the system, with the word system when it comes to medicine by different channels that we know today. It's like respiratory system, digestive system, or the urinary system, lymphatic system. We have many massages today over here. So you are familiar with the lymphatic drainage system, reproductive system, or endocrinal system, nervous system, circulatory system. So these are big systems that we are aware of. Today, what we are going to learn is more subtleties, what Ayurveda takes into consideration about systems. Okay, so the body has many srotas. Anything like simple arteries, capillaries, arterioles are also systems. They carry stuff within itself. So a srotas is a passage or a road or a path or highway. And there are many highways in our body, many paths in our body. If one highway is blocked, the other roads are open. Okay, so there are many channels which are interlinked with each other, and all systems are connected to each other. This is called as the Srotamsi. So when we say about the passage, there has to be a starting point and end point, and in between the road. Okay, so there is a starting point, ending point, and the road in between. So that is called as, these are the most important things that we should know about the srotas. Srotas, Mula. Mula means the root. Marga means the passage. And Mukha means opening. Can you write down these three words? Mula, Marga, and Mukha. We'll move to the next slide now. The concept of srotas is structural and functional. When it comes to structural, more the dhatus are more structural, and the malas, wastes, are functional. So for example, when it comes to the blood system, it's more of a functional thing, structural thing. But when it comes to the waste giving out, it's more of a functional thing. Certain channel exist that we cannot see them. Those are the mind channels. So we'll be learning about the Manovaha Srotas. Srotas, the description of Srotas is they are round in shape, they are broad, some are short, some are long, some are thin, some are thick. And just like the branches of the tree, they are spread all over and they carry stuff. These are called as the Srotas. There is a verse, I've just written it down for anyone who is interested to know and who has the basic books from Charak Chikitsa Sthan. Swadhatu samavarnani vrittasthula anuni cha srotansi dirghani anu krutanya sadrushani cha. So this is from Charak Chikitsa Sthan, 5th Adhyay, 24th Shlok. Just pen down if you want to write down the reference. Sroto dushti. Dushti means which can get vitiated. All srotasa are made up of dhatus, and dhatus are nourished by srotas. When the srotas is functioning and flowing normally in its state of health, we call it as health. And then disease begin when the srotas becomes imbalanced. And diseases are caused by doshas. When the doshas get imbalanced, they start disrupting the functions of dhatus, and dhatus contribute to srotas. So then srotas becomes imbalanced, and then it starts progressing towards disease. Now we can categorize these imbalances in 4 types. How are the diseases formed once they start affecting the srotas? So suppose first the doshas get into imbalance, then they start disrupting the functions of the dhatus. Srotasa are formed from dhatus, so then the dhatus start disrupting the functions of the srotasa, causing the diseases, right? So there are 4 basic types of imbalances, which we call it as sroto dushti. First is excess flow of anything in the body. It's called as ati pravrutti. That means things starts going out of the body because it's getting too much in the body. So usually anything that will flow out of the system, for example, like a person having diarrhea, it's like the body is getting the toxins out by itself because it has started building up in the system too much, and the body is unable to keep it. Runny nose, rhinitis, emesis, puking, menorrhagia, that means overflow of menses, or increased urine output. These are some of the examples of ati pravrutti. Second, sanga or stagnation, opposite of ati pravrutti, that is constipation, or maybe blood clots, or something coming together and stagnating, the cells coming together and getting compacted at one place, like tumors or varicosity. These are few of the examples of stagnation. Third, sira granthi, that is dilation, okay, expansion of certain things, includes tumors, diverticulosis, okay, expanded veins. This can be sira granthi. Fourth, vimarga gaman, that means false passage. So it goes, the things that are not supposed to go from that system, they start entering and disrupting the other system. For example, the circulatory system is supposed to flow the blood. The blood stops flowing from it. It is too much, so it starts coming into the lungs, and you have bleeding through the cough. or bleeding gums, or the water channels which is supposed to go out of the kidneys, it starts getting accumulated somewhere in the body, maybe near the knees, or in the pleural area, edema, or pleural effusion, or perforation, or fistula. Fistula is an opening near the anal area. It comes to the center from the skin to the skin. So some wrong opening is called as the false passage, where the body is trying to get rid of the excess toxins or excess doshas from the body. So there are 4 srotodushtis: atipravrutti, sanga, siragranthi, and vimargagaman. That means overflow, stagnation, dilation, and false passages. Any questions so far? Good. There are 2 types of srotasas. Bahirmukha, that which opens out of the body, and inside the body, the systems that are inside the body. That which opens out of the body, those are 9 in count: 2 nostrils, 2 eyes, 2 ears, mouth, anus, and urethral opening. And in women, breasts, 2 nipples. So in women, they are 11. They are called as srotas because they carry sensation, food, breathing. Something comes out from them or something goes in from them. Okay. So they are also passages. These are called as bahirmukha srotasa, that which opens out, and antarmukha, which are inside the body. So today we are going to learn the antarmukha srotas. Pranavaha srotas, ambuvaha srotas, अन्नवह स्रोतस, रसवह स्रोतस, रक्तवह स्रोतस, मांसवह स्रोतस, मेदवह स्रोतस, अस्थिवह स्रोतस, मज्जावह, शुक्रवह, पुरीशवह, मूत्रवह, स्वेदवह, and manovah. And in women, stanyavah. So I know these are all Sanskrit terminologies. Slowly you'll get used to it. Most of it is from the dhatus and from what we have learned before. Pranavaha being the respiratory channel, Ambuvaha the water system, Annavaha is the digestive system, Rasavaha is the plasma channel, Raktavaha is the circulatory system, that is the blood system, Mausavaha is the muscle system, Medavaha is the fat channel, Astivaha is the skeletal system, Majjavaha is the central nervous system, Shukravaha is the reproductive system, Purishavaha is the fecal matter, Mutravaha is the urinary system, Svedavaha is the sweat, and Manovaha is the mind channel. Now, learning the Srotasa, this is something that people who have been in the medical field, will be familiar with quickly. So we learn the root, the passage, and the opening. Okay. So when we learn of Pranavaha Srotas, there is a starting point, ending point, and the passage. So the left chamber of the heart is the root, passage is the respiratory tract, and nose is the opening for that. For the water system, pancreas and soft palate are the root, passage is the gastrointestinal mucous membrane, which helps to maintain the osmosis, and openings are the kidneys, tongue, and romacopa means pores of the skin, where we get goosebumps. Digestive system, the Annavaha Srotas, the root is the esophagus, greater curvature of the stomach, passage is the GI tract, and opening is the ileocecal valve. Rasavaha, the left chamber of the heart, passage is the venous and the lymphatic system. Openings are the arterial and venous junctions. Raktavaha Srotas, liver and spleen are the root, passage is the arterial system, and opening is again arterial and venous junction. So this is something to understand and after that memorize. Maunsavaha, the root is snayu and twak means skin. Passage is the entire muscular system and openings are pores of skin. Meda dhatu is the fat tissue. Omentum and adrenals are the root. Subcutaneous fat is the passage and openings are glands. Asthi, that is the bone. Pelvic girdle is the root. Passage is the skeletal system and nails and hair are the openings. Majja, brain, spinal cord and junctions of the dhatus are the root. Passage is sympathetic and parasympathetic nervous system and synaptic space is the opening. Shukra, that is the reproductive system. Testicles and nipples are the root. Prostate, epididymis, urethra are the passage and opening is the urethral opening. Moving towards the last few of things. Arthava, the passage is the full reproductive system itself, root is itself, and opening is the vaginal opening. Purisha, that is the fecal matter. Cecum, rectum, and sigmoid colon are the root. Large intestine is the passage, and opening is the anal orifice. Mutra, kidneys are the root. Passage is the ureters and the urethra, and opening is the urethral orifice. Sweat, that is sweda, sweat glands are the root. Passage is the sweat ducts, and openings are the pores of skin. And mana, that means mind, heart, and 10 important sensory pathways, one on each side, are the root. Passage is the entire body, and openings are the sense organs. So basically, I went through this list because you might want to memorize that. Okay, now we are going to look at one at a time. Any questions so far? None? Okay. So let's get started with the first system, Pranavaha Srotas. Prana is the respiratory tract. So prana, as we learned from the when we learned the Vayus, that it's the essence of Vata dosha. Vata and the space element. It is the main thing to perform respiration, oxygenation, and circulation in our body. So prana goes downwards and inwards. It governs all the sensory functions in our body. All the cerebral activities, mind, memory, thoughts, and emotions are governed by prana. So it controls the oxygenation, the functions of the vital organs, and the dhatus. Okay. So in Pranavaha Srotas, the organs involved are the nose, the trachea, the lungs, the alveoli, the bronchi. These are the main functioning organs of the Pranavaha Srotas. Okay. Now there are different reasons by which the prana can get into imbalance. And today we learn why it gets imbalance, what are the causes of getting that system into imbalance, and what are the signs and symptoms that we should know that this system is not functioning properly. The Srotas basically. What are the causative factors of Pranavaha Srotas Dushti? So basically, either it is aggravated, either it is increased, or it is decreased. So the symptoms will be either with the increased prana or decreased prana, increased vayu or decreased vayu. Okay. So the dhatu, the Pranavaha Srotas can get into imbalance due to many different reasons which are related to the respiratory tract, like upper respiratory tract infections, lower respiratory tract infections, chronic fever, debility, tuberculosis, which is the main one of the main disease of the respiratory tract, extreme dryness, which can cause dryness to the trachea and bronchi, causing cough, or suppression of natural urges to cough, yawn, or even sneeze. Certain weather conditions, like being in cold weather, in drinking cold water, prolonged fasting can increase vata, sinus infections, inhaling toxic fumes, or too much of polluted air, excess of alcohol, marijuana, tobacco, and steroids, or certain kinds of drugs, exposure to certain kinds of chemicals, or carbon monoxide poisoning, lots of pollens, allergies, dust, debris in the respiratory tract, or allergens, or physical trauma, emotional stress, cold weather, or emotional issues like grief and sadness for a long time, which can affect breathing, causing tightness of chest, causes functional breathing, or aspiration by accident, the food entering the trachea rather than in the pipe. So these are the causative factors by which the pranavaha srotas can get disturbed and can cause imbalance. How do we know, from what are the symptoms that we know that the pranavaha srotas is affected? Respiration. The main function of, so either it can be disrupted breathing, rapid breathing, or very shallow breathing, irregular breathing, functional breathing, or too long exhales and too short exhales, inhalation, breathlessness, wheezing, rales and bronchi in the chest when you auscultate, tightness in the chest, or chest pain, laborious breathing, sore throat, soreness in the vocal cords, sinus congestion, bronchial congestion, allergies, and diseases like bronchitis, pneumonia, asthma, pleurisy. Pleurisy is fluid in between the two layers of the pleura. So these are some of the signs and symptoms of pranavaha dushti, which denotes that there is a problem going on with the respiratory system. So this is the pranavaha srotas. Moving on to annavaha srotas. Anna. What does anna mean? Can someone tell me? Unmute. Can someone tell me anna? No?
The channel of food.
Channel of food. Anna means food. Okay. So it is the gastrointestinal system. Okay. The root is esophagus. We take the food from our mouth, it enters the pharynx, from there it enters the esophagus, and from there it goes to the stomach. Okay, so the root is the esophagus or greater curvature of stomach. So there is an anatomy of the stomach, there is a greater curvature and the lesser curvature of the stomach. Passage is the GI tract, full tract, right from the stomach to the small intestine to the large intestine. Opening is the ileocecal valve. Digestion takes place right from the tongue to the end tip. So that is the Annavaha Srotas. Agni plays an important role in digesting the food. That digestion is called as Pachan. Pachak Pitta does the Pachan. So Pachan. Pachan is a biochemical transformation of complex and large food particles to a simpler form of smaller food particles which are able to absorb, assimilate and absorb by the body or the cells. That is called as the digestion. So the basic function of digestion is carried in the Annavaha Srotas, and the food is transformed energies to the tissues in the Annavaha Srotas. Okay. There are different stages of digestion. The process of digestion starts from the Bodhak Kapha, from the mouth itself. The teeth helps for mastication. There are 4 different types of food mentioned in Ayurvedic medicine. Ashita, that means one which we don't need mastication for that. We don't have to chew that food. That is called as the Ashita food, that is soups. Khadita, that means that needs to be chewed, the regular food that we eat. Peyam, that means drink, something that we can drink, like smoothies or water or juices. And layam means that we lick, like maybe pickles or ice creams. So Ashita, Khadita, Peyam and layam. These are the 4 types of food. The tongue is the best nutritionist. It tells, because of the taste bud, we are able to know what taste it is. And then the taste bud starts secreting certain juices that helps and aids in digestion of that specific food that we have eaten. There are many, most of the subtypes or doshas, Vata, Pitta and Kapha, all in conjunct with Agni, plays an important role in digestion. So the prana helps the food to get inside the body and take it down towards the stomach. So the food, once we get into the system, the Jathar Agni, that is the digestive fire or the metabolic fire, kindles, and it helps to start the digestive procedure. Now there are different avastha paka or stages of digestion mentioned in Ayurveda. So there are 6 stages of digestion that takes place in the gastrointestinal tract. The first stage is the sweet stage or the madhura. Second is the sour taste, that is the amla avastha paka. Third is the salty stage, that is lavana avastha paka. Fourth is the spicy or the pungent taste, katu avastha paka. Fifth is the bitter stage, that is the tikta avastha paka. Astringent taste, that is the kashaya avastha paka. So once we take the food, it goes through all this process of digestion of different avastha paka. Approximately it takes an hour for each avastha paka. Digestion is a very subtle process that transforms the food into consciousness. So only food plays an important role in our mental state also. Or if we relate emotional eating also, how can emotions affect the eating? Because the food carries, food which we eat is digested and it nourishes our mind also. So the initial stages that takes place are in the Annavaha Srotas with the Kayagni or the Jataragni, or what we call it as the metabolic fire. And then it proceeds further to the Dhatu Agni, and from Dhatu Agni to the Bhutagni at the cellular level. Okay, so this is done by different laws for digestion, which takes place in the Annavaha Srotas. The 3 laws of nutrition. Have you learned the 3 laws of nutrition before? So this is just like an introduction. When you will be learning the digestion, you will be learning them in details. So basically, there are 3 laws of nutrition. The laws are irrigation, law of irrigation, law of selectivity, and law of transformation. Kedar Kulya Nyay, Khale Kapot Nyay, and Kshiradadi Nyay. So let me explain it to you how it works. When we take the food in our body, the stomach first makes it into chyle. That chyle is called as the Ahara Rasa. Now this Ahara Rasa goes all over the body. It's flowing all over the, circulating all over the body. So the end product of the digestive food called Ahara Rasa is going throughout body via the circulatory system. In the same way that a field is supplied with water by irrigation system. This law describes the initial digestive process through the point of Bhutagni breakdown. Later on, the Bhutagni works on that. Now, after the first law, the irrigation law, that everywhere the Ahara Rasa or the chyle is moving in the body, then every dhatu will come and take its portion that they need to digest. So the second law is called as the law of selectivity. That every dhatu, rasa, rakta, mausa, the tissue will come, take its portion, and then try to digest that portion. The Meda dhatu will come, take the Ahara Rasa's portion that is for the Meda dhatu, and it will start digesting. So we can imagine an analogy of 7 trees, and in each tree there is one pigeon sitting, and each pigeon flies to the field, takes its grain, and goes back to feed your one. Okay, so the field is like the body or the Ahara Rasa. The pigeon is like the immature, asthai dhatu, immature dhatu, and the younger one is the sthai dhatu, that is the stable dhatu. Okay, everyone is getting it? Yes or no? I need a little interaction here.
Yes, we would be.
I'm not able to hear. Nikki, you had something to say?
I
No?
just said that we're following you.
Okay. So the third law, let me proceed to the third one, transformation, the Kshiradadi Nyay. The convert into mature dhatu is the Kshiradadi Nyay. Asthai Rasadhatu through the Rasadhatu Agni creates the Sthai Rasadhatu, just like the milk through the process of fermentation creates the yogurt. Okay, so that's how the last and the stable dhatu is formed. So these are all the things that start at the Annavaha Srotas or the gastrointestinal tract. So what are the causative factors that can disrupt this process? Can anyone guess? I've already written down here. Eating. Eating is the most important thing that can disrupt eating and emotions, because they go hand in hand. So eating too much or eating too less, or eating wrong time, or combining different types of food that don't get along together, that are the incompatible food combinations. Emotional eating, or eating right after you had food, like eating, having lunch at 12 o'clock and then you feel hungry again, or let me grab an apple or something like that within half an hour. You often eat before even the digestion has yet started. So eating too soon after the meal, or eating late night, suffering from chronic indigestion, low agni, low metabolic fire, eating too heavy food in comparison to what Agni you have, too much of sugar or too much of any kind of taste, or if there is dosha aggravating diet, for the same vata person, keeping on eating dry, rough, cold stuff again and again, aggravating the doshas. And obviously caffeine, alcohol, tobacco, marijuana, drugs, steroids, some harsh chemicals. These are common factors for imbalances in any dhatu, any dosha, or any srotas. And lack of exercise. So these are the main causative factors for the gastrointestinal tract to get imbalanced. The signs and symptoms of Annavaha Srotas Dushti are pretty much related to Annavaha Srotas. One, maybe too much of hunger or loss of appetite, irregular appetite, feeling nauseatic, vomiting, indigestion, foul smell, halitosis, sticky stools, irregular stools, constipation, heartburns, acid reflux, teeth sensitivity, coated tongue, burping, low energy, fatigue, diarrhea, dysentery, constipation, irritable bowel syndrome, mouth ulcers, stomatitis is the mouth ulcers, glossitis is ulcers on the tongue, gingivitis is inflammation of the gums, excess salivation or dry mouth, chronic malabsorption syndrome, losing weight, abdominal pain, colicky pain, bloating. So these are all the symptoms that are created by the dushti of Annavaha Srotas. Moving on to the third Srotas, Ambuvaha Srotas. Ambu means water. It's also called as Udaka, Udakavaha Srotas. There are few synonyms for water in Sanskrit. Jala, Udaka, Jivana. These are few synonyms that are used for water. Our body is composed mostly of water. So it's very easy to get water imbalance. Blood, plasma, the cerebrospinal fluid, saliva, gastric juices, peptic juices, pancreatic secretions. These are all water content of our body. The root is kloma. Kloma means pancreas. And talu, that means soft palate. And the choroid plexus of the brain. Intestinal mucous membrane. And openings are kidneys, vrukka. In Ayurveda, kidney called as vrukka. Jimha is tongue. And romakupa, that means sweat glands, are the openings. Causes of Ambuvaha Srotas Dushti. So excessive, like too much of taking of fluid or no fluid intake. I'm always asked this question by many of my clients, that how much water should I drink? Every person has that question. They come to Ayurveda and specifically asking because 8 ounces or 8 glasses of water every day. Well, in Ayurveda, it doesn't say that. It depends what body type you have and what's the body's demand of that amount of water. So it's completely under your gunas, sattva, rajas, and tamas, that need to decide how much fluid intake you should have. So excessive or insufficient is person based. Suppression of natural urges, especially thirst. Overexposure to heat. If you're working in some condition where there is a lot of heat going on around, or in hot sun, It can cause ambuvaha srotas dushti, that is depletion of the water content in the body, profuse sweating and not drinking enough water, excessive exercise, chronic indigestion, emotional stress, nervousness, dry and rough food, or excessive or sugary food, overconsumption of spicy, salty food, or drinking alcohol, fasting for a long time, or excess intake of the substances that have a good water content, that is hydrophilic substances like cucumber, watermelon, sea salt, yogurt, cheese, and diseases like diarrhea or too much of urine output can cause the imbalance in the water channel system. The signs are related to water. So either it's too much or too less. If it is too much going out of the body, then it will indicate dehydration. Either dehydration, thirst, or excess hydration, that is water retention, edema, swelling, puffy eyes, or swelling in the knee, near the knee joints, edema in the knee joints, dry skin, dry mouth, hypoglycemia, oliguria, that is less urine, polyuria, more urine output, diarrhea, looser stools, dysentery, diabetes, increased intraocular pressure, that is glaucoma, increased cranial pressure, ascites, that is accumulation of water in the peritoneal cavity, pleural effusion, that is retention of fluid in between the pleural space, or pericardial effusion, that is the edema, water content in between the pericardium. So these are all the symptoms, signs that show that there is ambuvaha srotas dushti. Any questions so far with the first
Dr.
annavaha and ambuvaha srotas?
There's a few questions on the chat.
There are? Okay.
Can you access the chat?
I'm not able. Let me just open the chat. Let me see.
Abby, do you want to unmute yourself and ask your questions?
Sure.
I think so. That will be easier because it's really hard to read and then go. What is the Ayurvedic explanation of
There's
marijuana
music in the
during
background,
digestion?
so it might be kind of loud. I had a couple questions. My first question was, what is the Ayurvedic explanation for marijuana disturbing digestion? Is it just that it makes you overeat, or is it something beyond that? And then my second question was about exercise. What's considered excessive exercise in Ayurveda?
Okay. I need to check with the marijuana because depending on its rasa, virya, and vipaka, it will disturb the digestion. Okay. Because these substances are strong on digestion. So it depends on which rasa pak it has and then how it can disrupt. So I can get back to you on that marijuana in details.
Sure.
But with the excessive, what does excessive exercise? That's a very good question. So exercise should be when your body has started just slightly sweating. That is the optimum of exercise Ayurveda suggests. Okay. So this can be different for each person. This is the optimal level of exercise. When you start profusely sweating and you feel exhausted after the exercise, that would be the excess exercise. And how to determine the quantity of exercise a person should do, it depends on the season and the prakriti. So Vata personalities are delicate prakritis. So for them, they are more gentler and which are more for toning their system. Pittas, because they are go-getters and they have a good endurance, they can do sports, skiing, hiking, bicycling, and their tendency is to sweat more. So they can sweat profusely, but they should not feel depleted or exhausted after that exercise. And third, kaphas, they have really good endurance. So, but they sweat less. So for vatas and kaphas, it's hard for them to get sweat out. So when they start sweating a little, that's the optimum amount of exercise. One should have good exercise, but as we go towards summer, we should always do half of the exercise body needs to. So for instance, if I'm running 5 miles and that's my regular exercise pattern, then for for the summertime, it should be 2 miles or 2.5 miles. That is the exercise amount Ayurveda has. Abby, did I answer your
Yes.
question?
Yes, thank you. It's sorry, it's freezing a little bit. I don't know if
Okay.
it's happening for anyone else, but it's a little bit delayed. But yes, thank you so much.
That's okay. That's okay. Now from Hindu, I suppose, doing more than a division. Yeah, go ahead.
Oh, I have a question for you. Is there something that in Ayurveda that's just like when you go and you travel and the risk of diarrhea with the change of food that happens? Is there something to do as a preventative or something in Ayurveda? You know, when you go and you're going to a different country and you may have more hot and spicy foods because that is what's served in that country?
Yes. For example, India.
Mm-hmm. Right.
So yes, there are so many different kinds of preventive measures that you can take depending on again how your Agni is. So usually what happens is Pitta personalities can get really they're very sensitive. So with hot and spicy food, Pitta Agni or who has a Tikshna Agni can get tendency towards diarrhea. So there are different types of herbs, including one of the herbs which is good for all the body types, and it is called as the Maha Aushad. That means the best herb or medicine or spice, you can say, is dry ginger. The dry ginger powder is called as the Maha Aushad in Ayurveda, which is helpful from the upper tip to the lower tip. That means from the tongue to the anal tip. It does all good things. And so a little bit of dry ginger powder, ghee, and little bit of jaggery, ideally jaggery, if not then sugar, that combines all the stages.
You froze, Beena.
I'm freezing. Can you hear me now?
Yeah, you said with ghee and then with something else, but you froze.
Jaggery. Jaggery or sugar, whatever is available. And then make like small round balls, and then maybe like a half a teaspoon of it, and then take it every day. So that helps to not have diarrhea and yet aid the digestion, because many things that stop diarrhea usually mess up the gastrointestinal system. So we want to keep the digestive fire on, doing the digestive procedure properly and yet not causing loose motions. That is the intention of Ayurveda. So when you take Ayurvedic medicines, we don't stop diarrhea. We treat the diarrhea in such a way that you will have normal stools and yet your Agni is maintained.
Mm-hmm. Gotcha. Thank you.
I have a question.
I have a question. Oh, sorry.
Yeah, go ahead.
I just want, you've got written here, Pranama, function of Rasa Dhatu means nutrition, 9 Anjalis. So how do we know that it is equivalent to 7 quarts? How do we know what is the measurement of an Anjali?
I know. I'm going to come there.
All
we
right.
haven't yet started the Rasa Dhatu yet.
All right.
Any more questions? Let me see in the chat once again.
I had a question, but I'm not really sure exactly how to phrase it. So, and then we're talking about passageways. How does Ayurveda treat or deal with people who've had like gastric bypass and the passageways are no longer in the same way that normally they were born in? And I mean, so for example, if you're kapha, do you still give, kapha remedies even though the passageways are different?
I didn't understand your question. Can you repeat it?
So for example, if the person has had gastric bypass, so they're having their malnutrition, they're having symptoms that are different because their stomach is no longer as they were naturally born. So let's say it's been disconnected, their long intestine from their stomach, so it's no longer that passageway. So what is Ayurveda's I guess process in terms of helping clients that have those types of issues where they're not digesting the food as they normally would because they've had surgeries?
Right. And so in such cases, because these are extreme cases and there is an anatomical defect, not only physiological defect, a complete part is removed from the system.
Yes.
So at this point, we cannot expect that person to have the natural thing what they were having before. What we can do is through herbs and through restricting certain foods, we can aid the digestion. We can help the Agni to function at its optimal level, whatever is there. We should help that Agni to kindle. So the food should not be too heavy for digestion depending on what the Agni is. So if when in future you will be learning about Agni, like in metabolism, slow metabolism, high metabolism, hyper metabolism, regular metabolism. So these are different types of metabolism, and depending on the person who has been through that gastric bypass, what metabolism that person had, what was the original metabolism. If it was a slow metabolism, that means it was a kapha metabolism. So, and how is the metabolism right now? Is it the same? Is it slow? Or has it changed to irregular? Or has it changed to hyper? Depending on what is the current situation of that Agni, we decide what is the food that needs to be given to the person, and what are the dhatus that are malnourished because of the gastric bypass. So after the surgery, what are the effects that a person, maybe it is like depleted muscle tissue, feeling weak, or maybe lost lot of weight, or maybe feeling in the joints. So depending on what dhatu is affected, we decide the food. And then yes, herbs play an important role to aid the digestion, because the basic physiological functioning is, so we help that through giving the herbs.
Thank you. That was great. Thanks.
Okay. So should we move on to the rasa dhatu now? Okay. So rasa dhatu. So in this, one question which Indu asked, that how can we know the Anjali? What is Anjali? Anjali means bringing your both hands together, and whatever fits in this is called as the one Anjali. Okay. Now this is a very controversial subject in Ayurveda, that how the one Anjali, my Anjali will be different. The other person who is a big guy, his Anjali will be much more bigger. Or if a person is more tinier than I am, their Anjali will be smaller. So I wouldn't pay much attention to that. It's just written in the scriptures. It's just for your reference to know that that was how it was, the quantity was determined at that time. And so it's very subjective. So 9 Anjali doesn't have to be 7 quarts. It is given in Dr. Ladd's book. So maybe he must have done some certain research and come up amount. But Anjali is subjective matter. So my 9 Anjali can be less than 7 quarts also. And or for other person, it can be more than 7 quarts also. Okay.
So you measure with your hands?
Yes, both the hands together. This is Anjali. Can you all
I can't
see
see.
me?
I can only see your face. I can't
Okay.
see your hand.
Now, neither can I. I can also not.
Okay.
See, bring both your hands together. You know, how would you bring your both hands together like this?
Yes, I've got that. All right.
Okay, so this is Anjali.
Oh, that's one Anjali. Okay. Thank you. Now I understand it.
This is
Yeah.
one Anjali.
Thank you.
So, rasa dhatu is the first dhatu. So, rasa vaha srotas. So, now what I have observed in Dr. book, that most of the times he has described, and in a good way, that he has described everything in the modern terminology for a person to understand. So plasma and lymphatic system doesn't mean rasa. It's more than that. So it's when you start studying Ayurveda, it sinks into your mind, and then you can understand what exactly the function of the rasa dhatu is. Rasa plays an important function of maintaining the clarity and energy in our body. So rasa dhatu is very mobile, and it is spread all over the body. Prenanam means function, nutrition. Giving nutrition to the body is the function, basic function of rasa dhatu. So if a person is tired, depleted, long day of work, have no energy, the rasa dhatu is gone down. Okay. So the amount of rasa dhatu varies from person to person. How much water intake the person does, what is the diet, what is the form of diet, it depends on that. The byproduct of rasa dhatu, every dhatu has its byproduct, superior and inferior, the mala and the superior byproduct. The top layer of the skin is the superior byproduct of rasa dhatu. So people who have glowing skin complexion, fresh skin, those are rasa sara. That means the best essence of rasa dhatu we can see. Lactation and menstruation are the superior byproducts of rasa dhatu. Inferior byproduct of rasa dhatu is poshaka kapha. So kapha is the mala, or the inferior byproduct of rasa dhatu. So a person who is radiant, beautiful, I won't say beautiful, excuse me for that word, soft and smooth skin, hair are very soft and wavy, and a good complexion with no moles or acne issues, and has good strength and stamina, and emotionally is compassionate and loving, is a rasa sara personality. When emotions hit, it usually affects the fear. Basically, fear, nervousness, insecurity. These are vata based emotions. And vata is mobile and rasa is also mobile. So they travel very quickly in our body, okay, affecting the rasa dhatu. So the disorders of rasa dhatu would be lack of taste in the mouth, lack of taste in the life, excess salivation, heaviness, generalized body ache, or water retention, swelling are some of the kapha related issues in the rasa dhatu. Anemia is also connected to rasa dhatu. Ras and rakta both go hand in hand. So usually when rasa is affected, eventually the rakta dhatu will get affected if the rasa is not taken care of properly. And when rakta is affected, rasa has been already affected, and it affects the rakta dhatu. So women having premenstrual symptoms, breast engorgement, water retention, heaviness is due to the imbalance of rasa dhatu. Inferior rasa dhatu can cause wrinkling of the skin or losing weight, less glow on the skin, cold hands and feet, poor circulation, and it can create dehydration, that is dryness in the mouth, and inability to perform the daily tasks. One of the prominent low rasa dhatu sign is sound susceptibility. A person feels annoyed when he or she listens to loud music, or TV on a loud sound, or kids running around crazy with loud them. So that's a very typical sign when you have your rasa dhatu depleted. Chronic fatigue syndrome, and emotionally, it can create grief, sadness, and affect your menstrual cycle as well. Dhatu, the breasts become more enlarged and pendular. So depending on which dosha is in rasa dhatu, the symptoms may vary. Causes of rasavaha srotas dushti. Heavy food. See, these are the basic causative factors. You can put them anywhere. Basically, heavy food, that means the food that your Agni is not able to digest. That is heavy food for you. For example, cheese can be heavy for a Vata personality who has an irregular metabolism or for slow metabolism. But if a person has a really good appetite, that cheese does not be heavy to that person. Okay. But in general, cheese is heavy in nature. It depends on your digestion, how it can digest that. So when it comes to heavy food, it is very subjective. Heavy or overeating, eating cold stuff, cold drinks, oily and fried foods, leftover foods, very important, leftover foods, salt and sugar, excess hydrophilic substances like cucumber, watermelon, sea salt, incompatible food combinations. Too much of thinking is one of the cause of depleted rasadhatu, emotional stress, and lack of faith. Increased ama and strong substances like caffeine, alcohol, tobacco, and some of the drugs or medicines can also affect the functioning of the rasadhatu. Signs and symptoms. How do we know that the rasadhatu is affected? One, the agni is low. Many people or many persons will say, I used to feel hungry, but I feel that I don't feel like eating anything. There is no taste in my mouth. Or I have very sour, salty taste in my mouth, bitter taste in my mouth. Or emotions affect. If you had a bad day or bad relationship, it affects your appetite and it makes you nervous. It makes you down, which affects the appetite and affects first the rasadhatu. Why? Because when the ahar rasa or the kail is formed, the first dhatu to be nourished is the rasadhatu. It takes approximately 5 days to for the rasa dhatu to be prepared. It is approximation. It doesn't have to be 5 days. Okay, approximately 5 days for the sthai or the stable rasa dhatu in our body. So, if the rasa dhatu is depleted, it shows up right away on the skin. Okay, so fever, dark circles around the eyes, blackouts, heaviness, congestion, edema, dehydration, pallor, means the skin is white, emaciation, ringing in the ears, sensitivity to sound, high or low blood pressure, palpitation, that is tachycardia, increased heart rate. These are some of the rasadhatu dushti lakshana. Anxiety, lymphatic congestion, or generalized lymphadenopathy, sexual debility, hair loss, goosebumps. These are some of more of Srishti Lakshana. Lakshana means symptoms. When there is ama, that means there are ama in the rasadhatu, it creates body aches and pains, tongue coating, or the hair root ache. When people, there are many massage, a few of them you are have a person who you have given massage and doesn't respond well to that massage. Like they feel, in fact, they worsen after massage. They don't feel good at all after the massage. It's because the ama is in the rasadhatu. It creates more body ache and pain because of the ama. Lack of enthusiasm and poor sense of taste and smell. These are few of the signs and symptoms of rasavaha srotas dushti. imbalanced rasavaha srotas. Any questions so far? Please feel free to unmute and talk to me because I'm not looking at the chats right now.
I have a question. You said don't eat leftover food. Now, if we cook like today, I cooked rice and dal. Now, is it not good to eat it tomorrow?
Ideally, yes, not to eat tomorrow. Now, there is such a huge difference in the lifestyle here and what we have in. Yeah.
Because we have it in the fridge, it's not left outside.
I know. But Guru Gun, there are 20 attributes. There are different. When you cook the food, and if you keep it out, suppose for instance, if you have kept out the food in room temperature, some of the food items go waste right away, right? For example, if you cook it outside, the next day in the afternoon, it will already have a bad smell. Artificially, the cold, the refrigeration helps it to maintain the temperature and not make the food stale. But cold always increases heaviness. Okay, cold always constricts and increases the heaviness. So anything that is refrigerated, no matter how it is, like 4 months old or 3 weeks or 2 weeks or 2 days or yesterday, when it is refrigerated, because of the temperature, there is heaviness in that food. So the food becomes heavier in digestion. No, it doesn't matter if you microwave it again or you warm it up again, but the heaviness increases and it becomes difficult for the system to digest. So eating fresh is having sattva. Why it increases the heaviness? Because of the tamas. It is stagnant. It is sitting there for a day. So it becomes tamas. It adds tamas. It adds negativity. It has inertia. And so it becomes heavier. The heavier it is in digestion, the more energy your body needs to digest that food. And if it is not able to digest that food well, then it creates ama. So a person should not eat leftover food. Did I answer your question, Indu?
Yes, only thing is very difficult in this modern age of life when we are all working.
I agree.
I go once a week I cook.
I totally agree with you. However, it is better to get hit by a brick than a rock. So the best part is, instead of eating frozen food or food from the freezer, you can always refrigerate it, or preferably have it no longer than a day. So if you have cooked it tonight, you can eat it tomorrow morning, but try not to cook it for the whole week or 2 days or 3 days. Then the Guru Guna, that means the heaviness, keeps on increasing, and it's just merely just feeding yourself and stuffing your system, but the nourishment or the sattva energy is totally gone from the food.
Thank you.
Okay.
I have to change my style of eating.
And there are certain foods that can be enjoyed as leftover. For instance, now you're an Indian, so you know chapati. So chapati, if you eat, because it goes under Agni Sanskar, you put lot of like fulka, you put Agni, like means on the fire. You use fire for that. So it becomes lighter. But if you eat rice, it has water content in it. So it becomes much more heavier to digest the next day. Okay, so foods, there are certain foods that you can enjoy them as leftovers, but there are certain which you should not, and those are the varieties from which usually are the curries or the rice. Those get bad, stale, and then they can cause problems.
Okay, thank you.
Okay. Moving on to Raktavaha Srotas. From the Ahara Rasa, when I say Ahara Rasa, that means the chyle. That means the first juice that is produced from the first digested food that we have eaten in the stomach. Approximately it takes 5 days to form the stable rasadhatu, that is sthai rasadhatu, and the asthai raktadhatu. Are you all familiar with the sthai and asthai yes or no?
Say it again. What's the question?
Are you all familiar with sthai and asthai concept?
Isn't this the way it goes from the acute to the chronic?
No.
No, isn't that the stai is immature and then the astai is mature tissue?
Yes.
Okay.
Everyone is familiar with that, rest of them?
Yes.
Okay. So asthai means immature and sthai means mature tissue. So first comes the immature tissue and then the agni goes and then it makes it sthai. That means the mature tissue. Okay, in the 5 days. So first the So from the chyle, it takes first 5 days to prepare the rasadhatu. From there, raktu. From there, sadhatu. So slowly, the agni, dhatu agni, helps to digest. Helps to work on that immature tissue to make it more stable form of tissue. Okay. So Raktadhatu, Thai Raktadhatu is formed in the next 5 days, so 10 days. So Raktadhatu is the red blood cells and blood vessels. It is the carrier of nutrients to the tissues. Okay. Rasa and Raktadhatu are integrated and function together. Okay. Plasma and RBCs are together in the modern medicine. However, Ayurveda considers it as a separate entity. Prenanam, that is nutrition, is the function of Rasadhatu, and Jivana. Jivana means life, giving life, is the function of the Raktadhatu. Root is the liver and the spleen, from where the RBCs are formed. Passage is the arteriole system, the artery system, and openings is the arterial and venous junctions. The byproduct, superior byproduct, is sera or the blood vessels and kandara, that means tendons and ligaments. And the inferior is the poshak. Rakta gives energy, warmth, and color to the complexion. It gives longevity, and it has a typical pitta-like fishy smell. It gives life. So Raktasar person is having a very healthy complexion, warm, delicate skin with rosy cheeks, red lips, and lustrous eyes. Nails are pink, hands are pink. They are sensitive to sun and heat. They're very intelligent and vibrant in their energy. Okay, so Raktadhatu gives longevity. The disorders of Raktadhatu are related to Raktadhatu. That means the blood tissue. So either increased Raktadhatu or decreased Raktadhatu. So Raktadhatu is affected by, it's similar to Pitta. So spicy food, alcohol, tobacco, excess salty and oily food, too much exposure to sun or heat, emotionally getting too angry, and having sharp emotions. Hence, Pitta is affected and Rakta is affected. Bleeding from the natural openings. So when there is Ati Pravrutti, we saw overflow. So when the blood gets overflowed, then there is nasal bleeding, menorrhagia, heavy menses, hematuria, that is urine, blood through urine, bleeding through anal, hemorrhoids, piles, fissures, bleeding disorders in the skin, arterial rashes, inflammatory conditions, eczema, dermatitis, rash, infections like itis, any itis, pharyngitis, stomatitis, that is ulcers in the glossitis, ulcers in the tongue, hypertension, is increased Raktadhatu, conjunctivitis, infection of the conjunctiva. The decreased Raktadhatu or less of Raktadhatu, the person looks pale the other way. palpitation, breathlessness. There is opposite of heat, cold hands and feet, loss of enthusiasm, and the skin becomes very dry, rough, cracked and pale, and usually they crave sour things. Now, there are different kinds of imbalanced rakta, that is eczema, skin problems related to dushta rakta, that means the blood is vitiated. So, eczema, psoriasis, dermatitis, bleeding gums, bleeding through the skin, these are the rakta dushti. When pitta is prominent in Rakta Dhatu, we can see herpes, herpes zoster, herpes simplex, or mononucleosis, splenitis, discoloration of skin. When Vata comes in Rakta Dhatu and is more prominently expressed, then there are small freckles on the skin, blood clots, when varicosity in the veins. So depending on which Dhatu is more imbalanced, it shows those symptoms. Now, what can be the causes of Rakta Dushti? Again, everything comes to basically food and your vihar, that means the lifestyle. So basically eating more hot and spicy food, excess salty food, heavy food like yogurt, cheese, fermented food. Fermentation is more acidic. It tends our body to make more towards acidic side. Oily and fried foods, peanuts, sesame seeds, which are so abundantly used all over the US, peanut butter, So one has to be very careful. When you eat peanut butter in summer, you have to be really careful. Almond butter, cashew butter, tahini sauce. So these are so abundantly used in the food. Incompatible food combinations, caffeine, alcohol, working in the sun, exposure to the radiation or sun, too much of sun, emotional factors, agitation, or emotions like anger, hate, aggressiveness, go-getter, doing things, and external factors like bacterial infections, wounds, skin infection, too much of consumption of alcohol causing liver issues, spleen disorders, are some of the causative factors which can cause dushti of the rakta dhatu. The signs and symptoms are pretty much the same we discussed: eczema, psoriasis, all skin conditions basically, acne, hives, rashes, spreading, because spreading is the quality of pitta, spreading is the rakta goes all over the body. So we see the effect of this dushti all over the body. How is going on? Burning sensation in the eyes, burning sensation in the anal area, bleeding gums and teeth, bleeding disorders, hepatitis, hair loss, blood clots, venous engorgements, anemia. These are some of the dushti. These are some mentioned signs and symptoms of raktavaha srotas dushti. Okay. Any questions so far? So if there are no questions, let's take a 10 minutes break and join in by 8:10. Is that okay, Renee?
Yes.
Okay. So I'll meet you at 8:10. And we'll start with Mausavaha Srotas.
Yes.
Okay.
Yes.
So we'll start
Yes.
with the Mausavahasthas. The Mausa Dhatu is created from Asthai Mausa Dhatu. So Asthai Mausa Mausa Dhatuvagni works on it, makes it as Sthai Mausa, that is mature Mausa Dhatu. It takes about 15 days for Dhatu to be converted from the Ahara Rasa, that is the chyle. The Mausavaha Srotas is nothing but the muscular system, and it is derived from mainly water and earth, so it's heavy. Fire is also present, but in a little less quantity than water and earth. The blood helps the Mausa Dhatu to move. So the more exercise we do, the more the blood gets circulated. The more the blood gets circulated, the more energy the Mausa Dhatu gets. So main function of the Mausa Dhatu or the muscle tissue is ambulatory movements. Movements of the joints, walking, uh, any movement. It is firm, it is bulky, it is dense and elastic. So it has kapha dosha also in it. So it gives basically shape, structure due to the Prithvi Mahabhuta, that is the earth and water element in it. It helps in coordinating. So it has a function to play with Majja Dhatu also, neuromuscular. Nervous system and muscular system, they work together. So power, ambition, courage, and it supports the bony structure. It provides protection, covering delicate organs. So it is basically responsible for movement in the body. And it keeps us awake and alert. It gives expressions, facial expressions. There are so many muscles in our face. So Mausadhara Kala is the membranous structure between the two muscles where the Mausadhatu Agni resides and helps it to convert the Sthai product of Mausadhatu is the subcute fat, Tvacha and Vasa. Vasa is the subcutaneous fat. The inferior or the mala of Mausadhatu is the nasal crust, ear wax, sebaceous secretions, tartar, and smegma. Together they are called as the khamala, which are in the cavities. A Mausasara, the best of the Mausadhatu in a person, will have well-developed cheeks, necks, broader chest, good biceps, triceps, and calf muscles, well-rounded buttocks, and well-shaped body. A good stamina, courage, power, strength, because that's determined from the muscle tissue. Compassion, love, forgiveness. These are the emotional aspects which are related to the Mausadhatu. And the person good the Mausadhatu money. So basically it is without good rasa or
A little bit.
dhatu.
I don't know if you heard me. Oop, we lost her.
Please.
Dr. Vina, we can't hear you. Can you hear me?
Yeah, I can hear you.
You're breaking up a bit. Oh, I think we might have lost her completely.
Hello?
Hello?
Can you hear me, Renee? What happened?
I can hear you now. You disappeared. I don't know if you got knocked offline or.
Now can everyone hear me?
You're breaking up a little bit.
Yes. Cannot hear.
Okay. Let me turn off the heater in my room. Let me see if that is taking the power, which I did out on yesterday only. Let me just check. Okay, just give me a minute. Hello?
I can hear you.
You can hear me right now?
Yes, we can hear
Yeah.
you.
Okay,
I can hear
good. Okay, so where would we? Okay. So, Renee, I just tell you from my screen because I'm not able to see anyone. I'm just able to see my presentation now.
Okay. I think some people went off their cameras because they thought that would help the internet.
No, but I'm not able to see any cameras, but I'm not able to see the screen.
Can you share your screen again?
That's what I'm going to do. I'm just going to try to.
You're still the co-host, so I don't think you completely got knocked off.
Because if I want to chat or say anything, I'm not able to see the screen.
Yeah.
Okay, let's continue with this now. And if there is anything, just let me know.
Well, they can follow along in their
Should
book.
I?
We can follow
because I'm not able.
If you put your PowerPoint, we can follow when you're talking.
Yeah, I think so. Let's do that. So if you have any questions, just unmute yourself because I'm not able to see anyone right now. So causes of Mausavaha Srotas Dushti, that is things that can cause muscle problems. Heavy foods such as meat, too much of protein or less protein, dairy, cheese, yogurt, combining many proteins at one time. Trying to give you the best of all the proteins from dairy part, from the meat part, from the grain compatible combinations, less exercise or too much exercise, sleeping during daytime, insufficient sleep, or physical trauma like accidents that cause nerve problems and eventually affect the muscle system. So neuromuscular issues, tuberculosis, alcohol, and many harsh medications, steroids, can cause Mausavaha Srotas Dushti. Signs that we know that the muscle system is not working properly is one, through muscle aches and pains, or tics, muscle tics, wasting, this growth of the muscle, hypotonia, like flaccidity in the muscles, muscle hypertonia, abscesses, tonsillitis, polyps, enlarged cervical lymph nodes, loss of power, paralysis, loss of function, stroke, Bell's palsy, neuromuscular dystrophy, fibromyalgia, feeling fatigued, myoma, that are the muscle tumors, fibromas, that are the muscle fiber tumors, fibrosis tumors in the uterus. These are some of the signs and symptoms of the muscle tissue disorder or dushti of the Mausavah Srotas. Moving on to the next fifth one, Medovah Srotas, the channel that carry the fat tissue. Mula is the omentum, which is like a curtain to the function is for protection and lubrication. So it's on the omentum and the adrenals. Marga is the subcutaneous fat tissue. And mukha, the openings are the sweat glands. So fat is water content. It's kapha, soft, oily, and its main function is snehana or lubrication and freedom of movement. No fat tissue, no matter how healthy the asthi dhatu or the bone tissue is, there will be friction happening. And though, no matter how healthy the bone muscle tissue is also, it will have a restricted movement. So Meda dhatu helps to give that groundedness, lubrication or snehana in the functioning of the muscle and asthi dhatu. It's bulky and it's present beneath the skin in the form of subcutaneous fat. It helps to maintain the temperature. So if there is Medovah Srotas Drushti, either a person can feel too hot or can feel kami cold. They can be affected by temperature. It is present in between two muscles and creates less friction in between the muscles. And if the Meda Dhatu Agni is low, then it leads to accumulation of too much of fat under the skin and in the areas like thighs, lower part of the body, because water and earth goes to gravity. So buttocks, thighs, hips, that can be more Medovah Srotas Drushti. The byproduct of Meda Dhatu is Snayu, that is the flat muscle, and sweat is the mala, that is the waste. Now here also it is measured that 2 Anjali is meant in the body. However, it's very hard to measure 2 Anjali and know that, okay, this, because it is an individual fact. So this is just again a measurement that is given and may not be applicable as a standard format. Disorders. Meda Vruddhi. Vruddhi means increased. If the Meda Dhatu or the fat tissue is increased, it's weight gain and it causes lethargy and pain in joints, breathlessness on exertion. It reduces or slows down the metabolism, creating underactive thyroid gland, profuse sweating, no sweating, lipomas that are muscle fat tumors, hypertension, low libido, gallstones, excess thirst, and sweet taste in the mouth. Less of fat tissue can cause dryness, vata increased, so it can cause cracking and popping of the joints, emaciation, loss of losing weight, osteoporotic changes, hyperactive thyroid, bone loss, and enlarged spleen. Can everyone hear me?
Yes.
Okay.
Yes.
Yes.
So what can cause by Medovah Srotas Drushti? So we all know that, we stay in the US and most of the times, we see and we are concerned about the food that we eat, and which again has an impact on our Agni. So basically heavy food can cause weight gain. We all know that. Lot of carbs and dairy products, cheese, cold items, refrigerated items, leftovers, incompatible food combinations, lacking in taking good fats and taking unhealthy fats, stress, lot of stress, unresolved emotions, or problems in the relationships which causes emotional eating, sedentary lifestyle, daytime sleeping, which is one of the main reasons Ayurveda discourages to sleep during the daytime or after meals, insufficient exercises, which can cause ama formation, and then it increases the wrong kindling of the agni. So a person feels hungry again and again, and whatever the person eats, the meda dhatu agni transforms it to asthai meda dhatu, that is immature fat. So that immature fat is the culprit, where the good fat will always have a good function of lubrication and protection to our body. So pretty much the factors that contribute for imbalance for the Mansavaha Srotas can cause Medovaha Srotas Dushti also. Obesity, diabetes, excess urination, overweight, burning feet, and sweetness in the mouth is increased Meda Dhatu. And emaciation, weight loss, lack of lubrication, excessive sweating, underactive thyroid, and breathless are the Medovaha Srotas Dushti Lakshana. Moving on to the Astivaha Srotas. Asti is bone, skeletal system. Earth, air, and water are the main components of Astivaha. Earth being the main because it gives us good structure and stability, and 15% of water and 5% water in the periosteum, and mainly air. So Vata can be usually, when Vata is aggravated, the bones are affected right away. It gives good internal support and shape to the body, and it creates cavities in which it gives protection to the organs inside, like the heart is protected, the lung is protected under the rib cage, the pelvic organs are protected in the pelvic cavity, the brain is protected under the cranium. Okay, so it has also an important role to play in conducting sound waves that aid in hearing. So there are 3 bones in our ears, stapes, incus, and malleus, which helps for the conduction of the air and helps us in hearing. Locomotion, that is movements of the body, are governed by the Asti Dhatu. So periosteum, which we call it in the modern term, that we can interpret that as the Asti Dhara Kala. That means that where the Asti Dhatu Agni resides, and it converts the immature Asti Dhatu into mature Asti Dhatu. That is the periosteum or the Asti Dhara Kala. Please let me know if I'm going too fast, okay? And if you have any questions, feel free, because I'm not able to see anyone right now. Sorry. So the products of Asti Dhatu are teeth. The Upadhatu is the teeth, nail, and hair are the mala. Okay. So, and from it, the immature Majja Dhatu is also formed. So Majja Dhatu is present. Majja is a nervous system. Majja Dhatu is present at the root of the hair and nail. It is not present. The sensations are not present in the nail and hair, but the sensations are present at the root of our nail and hair. So if we have a prick, or if there is some cuticle which is bothering us, if we take it out, the nail starts hurting. But when we cut our nails, we don't feel that pain, because the Majja Dhatu is not at the end tip of the nail or hair. So the disorders of Asti Dhatu are excess of that, like spur, or bony protuberances, or osteomas, calcification of the bones, or abnormal curvature of the spine, kyphosis, lordosis, scoliosis. These are different deformities of the vertebral column. Bone fusion or extra teeth, excess hair growth are Asti Vriddhi Lakshana. And less of Dhatu can cause osteoporosis, rheumatoid arthritis, joint aches and pains, or fractures, scoliosis, brittleness in the hair or nails. So these are the symptoms of low Asti Dhatu. Again, diet plays an important role, because if you eat vata provoking diet, it's going to increase the air element in the asti dhatu, causing osteoporotic changes and degenerative changes, poor posture, excess exercise, too much of exercise, too much of weightlifting, jogging, jumping, climbing, skiing, or insufficient exercise can cause dushti. Physical trauma like accidents, which are the one of the main causes of asti dhatu dushti. Vata type emotions, anything that increases vata can increase asti dushti. So one of the interesting facts that I found in Dr. Lard's book is astronauts in space lose bone tissue because healthy bones need to pull off gravity. So this was something interesting. You might also find when you were reading his book. Signs and symptoms of asti dushti: cracking and popping of joints, stiff joints, aches and pains in the joints, different types of arthritic changes, rheumatoid arthritis, fractures, and we went through all the misalignments of the spines, hair discoloration, split ends, backaches, lumbar aches, hunchbacks. These are some of the asti dhatu dushti lakshana. Any questions so far?
I'm sorry, I have a question.
Sure.
Professor Bina, how do we know that the exercise, what we are doing, is enough for us?
Again, just like I mentioned before, when it doesn't exhaust you.
Okay.
One, there are so many factors here, Indu. If you have ama in your system, it can make you feel exhausted right away. Okay, so one person has to know that there is no ama in the system. How to know whether we don't have ama? There are different types of lakshana or the agni, which proves that whatever we are eating, we are digesting well and eliminating well, and we have in general good energy to maintain, and different through tongue, through pulse, and through overall balance, we know that there is no ama. So if a person is healthy, that healthy person needs to know how much to exercise to do is depending on the breathing, heart rate, sweat, and how a person feels after the exercise is done. These are the subjective, I would say, signs that a person should know. So it is not like you take 200 calories and you burn out, 2000 calories per day, and you burn out 200 calories, 400 calories, or 500 calories. It doesn't go with that standard structure. It goes on a very subjective matter, how a person feels after doing the exercise.
So it's personal tolerance.
Personal tolerance, correct.
Thank you.
Okay. Let's move on to the Majjavaha Srotas. Purana is the function of Majja Dhatu. Majja means the central nervous system. Okay. The nerve tissue. Filling up the space is the job of the Majjavaha Srotas. It includes bone marrow, which is a soft jelly-like structure in the cavity of the bone, and it has a function of producing the red blood cells. Nowadays, the stem cell surgeries, everywhere they're talking about that. That's the bone marrow thing. Majja Dhatu has an important function of communication. So it is present in the brain, hypothalamus, spinal cord, and in spinal nerves, interspinal nerves, and the cranial nerves, including the subacute nerves, which come to the end of the skin. So Sthai Majja Dhatu is formed from the Asthai Majja Dhatu. It is the immature Majja Dhatu. From Majja Agni, it creates mature Majja Dhatu, which is composed of amino acids, neurotransmitters, which are essential for the metabolism of the nerve cells. So we comprehend, we understand through Majja Dhatu. So a good Majjasar person is an intelligent person, attractive, who is a brilliant person. And Majja Dhatu is responsible for sensations, tactile sensations of touch, pain, temperature. And the byproduct is Ashru, that is tears. And the inferior byproduct is the Akshi Vita, that we get it every morning when we wake up. That is the Akshi means eyes, and vit means fecal matter. So whatever is the waste matter. So the oily secretions from the eyes are the inferior or mala product of the majja dhatu. Disorders of majja dhatu, majja vruddhi is tumors in the brain, heaviness of eyes, excess sleep, or heaviness in the hydrocephalus, accumulation of fluids in the ventricles of the brain. Less majja dhatu can again create osteoporotic changes, because purana, that is filling up the space of the bones, is the job of majja dhatu. And insomnia, neurological problems, Parkinson's, lower motor neuron diseases, upper motor neuron diseases, paralysis, epilepsy, attention deficit disorders, poor communication, lack of focus, lack of understanding are some of the majjavaha srotas dushti lakshana. What can cause that? So again, without food, no. So poor diet, incompatible food combination. Vata can easily affect the majja dhatu. So vata provoking diet, traumas, accidents, roadside accidents, emotional trauma, stress, unresolved emotions, worrying, anxiety can cause majja dhushti. Many high fever, when a person has high fever, they start having a delirium. They start blabbering and speaking whatever, because it affects the majja dhatu. Viral infections, cerebral concussion, compressions, heavy metal toxicity, exposure to the radiation, and some caffeine, alcohol, these kinds of marijuana, these kinds of drugs can also cause majja dhatu dushti. The signs and symptoms are pretty much the same that we discussed just a few minutes back, that there are many disorders which include multiple sclerosis, neuropathy, sciatica, paralytic stroke, brain tumor, different types of phobia, memory loss, anxiety, tingling and numbness in the hands, ringing in the ears are some of the signs and symptoms of majjavaha srotas dushti. Any questions so far? Is it too fast?
No, I can understand it. It's okay. We have a long way to go.
Renee, should we continue? I think so. Let's continue with the Shukravaha Srotas. Shukra Dhatu. Shukra means sperm. Okay. And Shukra in women means Artava. Okay. So Shukravaha Srotas in women is Artavavaha Srotas. So Shukra sperms are white, liquid, jelly-like, cool, with smell of honey and sweet in taste. Now the organs that are involved are testicles, seminiferous tubules, epididymis, and the spermatic cord. Within the wall of seminiferous tubules is the kala called as the Shukradhara kala. From there, the sperms are created. There is an Agni present there, consisting of enzymes, amino acids, and hormones. So this Shukradhara kala is active at the age of puberty and is responsible for the secondary sexual organs like beard, mustache, axillary and pubic hair. And Shukra Dhatu is present all over the body. And so only it travels all over the body, so a touch can create a sensation for sex. The Shukra, Asthai Shukra Dhatu is converted into sthai or mature Shukra Dhatu through Shukradhara Kala. So the epididymis is the structure, a long structure, which is 20 feet long. That is the most longest structure in our body. It is the mother of the sperm. So the mature sperm passes through this epididymis, through the spermatic cord to the prostate gland, which is another gland which secretes prostatic fluid. And when the sperm mixes with the prostatic fluid, it is called as the semen. And in this, the sperm flows through the prostatic fluid and swims rapidly and passes through the urethra, through the genital organ. And when the sperm epididymis becomes mature, it creates a desire for making love. They send the electromagnetic energy to the penis, and the penis becomes erect. This is how the function appears in the Shukravaha Srotas. So when a man ejaculates, it has many millions of sperms are released, and only one is needed to fertilize the egg. If there is no spermicidal chemicals in the vagina, sperm can stay alive for about 7 days. Okay? And this sperm is rich in fluid, zinc, protein, and mercury. So it gives strength and vigor to the body when preserved. The causes of Shukravaha Srotas Dushti is again incompatible food combination, having intercourse at the wrong time, that is midnight, dawn, dusk, daytime, or right after meal. So the best time would be right before bed, that is 10 to 12. Overindulging in sexual activity, or having lot of orgasms at one time, or intense sex with intoxicants, substances, physical or surgical trauma, or sexually transmitted diseases like gonorrhea, syphilis, and emotional stress, worries, masturbation, drugs, and excess meditation, because all these can increase vata. The vata increase, there is sexual debility causing Shukravaha Srotas Dushti. Some of the signs and symptoms of Dushti are sexual debility, premature or painful ejaculation, low libido, impotency, low sperm count, infertility, prostatic hypertrophy, inflammation of the testes, or blood or pus in the semen, autoimmune disorders, or sexually transmitted disorders. Any questions?
We should.
Okay, let's.
Yeah, we can continue the next
continue. Okay. I can just hear Indu. Where are the all others? I hope you're all not taking a nap.
We're here. Still here.
Say hello to me.
Hello.
Hello.
Hi.
Oh, now I hear you. Okay, good.
That's from Casey. Shh.
We're all here.
We are busy listening to you.
See, now I feel everyone is awake. Artava Vaha. So I know it's a very long and tedious topic, but this is all. Yet we have many Srotasas to go. So what we learned in 1.5 years, I'm trying to teach you in 2.5 hours. Artava is the female egg. It is hot and passive. So it's the opposite of the Shukra. And female eggs are formed in ovaries. Cells called Artava Dhara Kala are present in the ovaries, ovary Agni, and is present in the Kala. So these ovaries are the primary organs of the female reproductive system. And they have twofold functions. One, they produce the ova, and also they produce the hormones, estrogen and progesterone. These are the ovaries are smooth and firm, similar to an almond size and shape, located in the pelvic cavity, and they are attached one to the uterus, and then the other end is floating. So ovulation occurs, and when the ovum gets mature, it comes and it waits in the fallopian tube. There it waits for 5 to 7 days approximately. And if at that time, there is coitus or intercourse happens, then the mating is happened in the fallopian tubes. And if it doesn't, then the ovum dies and is discharged in the form of menstruation. So this is a very short, I would say, process I have tried to explain with the Artavavaha Srotas. There are similar factors that can cause Artavavaha Srotas Dushti, like Shukravaha Srotas. All the causative factors that are involved in Shukravaha Srotas Dushti can cause Artavavaha Srotas Dushti. In addition to that, emotional stress, worry, miscarriages, including syphilitic stillbirths, tuberculosis, anemia. Why tuberculosis is mentioned? Because in many developing countries, tuberculosis has been a major part of infectious disorder. We don't see it much in the US, but it is present in many of the developing countries. Anemia, obesity, drugs can cause problems related to the female reproductive system. How we know what are the symptoms and signs and symptoms? That is premenstrual symptoms, very common today in the US. Dysmenorrhea, amenorrhea. Dysmenorrhea means painful menses. Menorrhagia means overflow of menses. Amenorrhea means no menses or less menses. Breast tenderness, swollen breast, fibrocystic changes in the breasts, irritability. Leukorrhea is white discharge, endometriosis, blocked tubes, fallopian tubes, prolapsed uterus or vagina, venereal diseases like gonorrhea, syphilis, miscarriages, abortions, painful coitus, cervical erosions, and the list goes on, vaginal dryness. So these are some of the signs and symptoms of Artavavaha Srotas Dushti. Now, did I jump to? In female, Stanyavaha Srotas is also there, the milk channels. So, and they are active mostly during the lactating time. So that is the time when women has to be careful to have the best quality of milk. The Rasavaha Srotas is important because Stanya and Artava are the superior byproducts of Rasavaha Srotas. So whatever affects the Rasavaha Srotas, it is going to affect the Stanyavaha Srotas. In that, similar factors like heavy food, leftovers, excess salt, sugar, incompatible food combinations, caffeine, this can affect Rasavaha Srotas and then affect the Stanyavaha Srotas. Symptoms are when underactive or underdeveloped or poorly developed breast, profuse or insufficient lactation, mastitis, breast abscess, breast tumors, breast cancers, fibrocystic changes in the breast. These are some of the signs and symptoms of Stanyavaha Srotas Dushti. Any questions so far? I know for me itself, I can feel that I'm going too fast, but we need to cover this. So if you have any questions, feel free to, I'm okay if we can extend also a little bit, but I just don't want to read and just go through it. Anyone? Should I continue with the rest three?
This is a big chapter. Are you going to finish this chapter with us today?
I think so. That's what I'm told.
Okay. All right. Let's carry on then.
What I would suggest, because I personally feel that it is too much in 2 hours, it's a big chapter. And so what I will suggest is, I have this time, my old presentation is from Dr. Lard's book itself, because that's your syllabus book. So go through those, all these Srotamsi, and if you have any questions related to the topic, we can discuss it for our next time. Pen down those questions and I'll be happy to go through it.
I have a question. We have this, the kosher sheets of the body, and it's on page 195. I was wondering if you could just review that with us?
Unfortunately, not today because Indu, we have 3 more Srotasa to go.
Oh, okay. All right. That was
Okay.
kind of a little bit of a, that's a
So
tough.
we can, yes, it comes under the Manovaha Srotas, and that is a whole big chapter. So anyways, we'll come back to causes of Purishavaha Srotas Drushti, that is the fecal matter. Okay.
Okay.
So that's the end part of the gastrointestinal tract. So the things, the fecal matter, we all know how important the elimination system works. Whether it's too much, causing diarrhea, loose stools, or stagnation, causing no stools, or constipation, or dryness in the colon, which is one of the most, I would say, seen disorder in my practice here today. And so lack of exercise, suppression to the natural urges. There are 13 natural urges. Are you aware of the urges, natural urges that needs to be controlled, and 6 natural urges that not need to be controlled? Sorry, to be controlled? Have you been taught that?
No.
Okay. So you can go in the books and see there are 13 urges. So please interrupt me whenever you don't understand those, because this natural urges has come so many times in the previous sotas also. So there are 13 urges that needs to be controlled, need not to be controlled in our body. That includes sneezing, yawning, coughing, going to the bathroom, urinating, sleeping, passing out gas, and so on. And there are 6 urges that a person should control. That is greed, envy, jealousy, hatred, all those things. So those you can find it in some of the lads book, or you can just Google search, you will find those urges. So trying not, these are one of major factors for creating imbalance in the body. Irregular dietary habits, traveling. Lots of people travel long distance by air, which increases vata, and jet lags, and causing irregular timings of food, spoil leftover foods, incompatible food. I don't want to go with those things again and again. But eating too soon meal is one of the snacking, and less fluid intake can cause Purishavaha Srotas Dushti. Emotional eating. Emotions have a major role to play in bowel movements. We all know that. So signs and symptoms are basically related to the elimination. So either it's too much or too less, hard, painful, or not satisfactory. Hemorrhoids, fissures, fistulas, prolapsed rectum, rectal cancers, ulcerative colitis, parasites, foul smelling feces. One of the things that I usually ask, that when you flush your toilet, does it give any marks on the toilet bowl? That is the sign of sticky stools and ama in the system. Parasites, irritable bowel syndrome, colitis, bad breath are some of the Purishavaha Dushti reasons. Moving on to Mutravaha Srotas, that is the urinary system. Again, too much of excess of fluid intake or no fluid intake, excess of salty food, or prolonged fasting, having hydrophilic substances like watermelon, cucumber, yogurt, cheese. Too much of diarrhea also causes, it affects the kidneys and the urinary system. Suppression again of natural urge like urinating, drinking too much of water or no water, then the bladder is full, having sex during that time. Infections, bladder infection, renal infections, diabetes, and sexually transmitted diseases are some of the urinary tract infections. Stones, renal calculi, these are the some of the Mutravaha Srotas Dushti causes. signs and symptoms of Mutravaha Srotas Dushti. So basically it is related to urine. So you will find all the symptoms that are related to the urine. So maybe it's incontinence or going too much, urinating, that is polyuria, or no urine, anuria, less urine, or painful urination, dysuria, blood in the urine, hematuria, protein loss in the urine, albuminuria, semen in the urine, semenuria, crystals in the urine, crystalluria, okay? Burning sensation during urination, dark yellow, brown or orange colored urine, turbid urine, urine retention, which causes backaches also. So, and kidneys are related to fear and anxiety. So when we are anxious or fearful, we use the bathroom more, you know. So those are the emotional factors that show us that there is an Mutravaha Srotas Dushti Lakshana. Now we are towards the end and the last Srotas. Is everyone awake? Please say yes.
Yes, we are awake.
Yes. We're
Only
ready.
Hindu is awake.
Yes.
Yes,
Yes.
We're all awake. We're all awake.
very much awake.
We're all
Okay.
listening to you.
I know, because this is the last Srotas, now we are on to it.
This is very interesting. Very much awake.
I know that I have been gone too very fast, because I can imagine how I am going too fast, and I don't know how much you are understanding, but I hope that I am trying to make it a little precise for you. These chapters are really big and important chapters, and they cover lot of part related to the dhatus and systems. So you might have to really go through it, and feel free to email me if you have any questions. So last is the Svedovaha Srotas. Again, Svedovaha is sweat. So excess sweat or no sweat. Okay. So, or foul sweat. So these are the three things. So excess or insufficient intake of fluids. We can feel the difference, especially Pitta personalities. They can feel what they eat, you know, they can have this, they can feel the foulness in their sweat itself. So hot, spicy food, oily food, excess sugar consumptions, caffeine, everything is detoxified through sweat. There are so many detoxification therapies in Ayurveda which involves the sweat. I think we are going to learn Panchakarma. I'm going to talk to you about that. That time we'll learn. So sweat is one of the way to detoxify our body. So if the toxins are inside, then they can cause problems. So no sweat can cause issues in the system. Excess or insufficient exercise, excess sauna or hot bath, emotional stress, extreme cold or heat, or alternate heat and cold therapy, working for a long time in the sun. Anger also creates sweat. Fear also creates sweat. Anger creates hot sweat. Fear creates cold sweats. And so also sweating depends on the personality, like what is your dosha type. If a Vata person exercises, that person may not sweat or may not sweat at all. So that's the tendency, because they don't have anything water content in their body to give out. They need more water. So whereas the Kapha personalities, they have to really work hard and lose some water through their sweat, because it helps to detoxify, because they can hold up easily that water content. Whereas Pitta can easily sweat. But if their sweat is too foul, it is foul anyways, but if it is too foul, then they need to go for some detoxification measures. So what are the signs and symptoms of Svedovaha Srotas Drishti is lack of sweat causing dry skin issues, rough and scaly skin, or excess perspiration causing wet, soft and slimy skin, fungal infections, burning sensation, goosebumps, acne, dermatitis, eczema, psoriasis, in extreme cases, leprosy. Okay, so these are the symptoms. Now this is a whole big chapter, a very big chapter, which itself needs 2 hours, I would say, to explain. But I have just cut short it for you so that you can read in Dr. Ladd's book more in details. Manovaha Srotas. This we cannot see, but it's there. It's present. State of mind. So there are different states of mind, and these are the Sanskrit terms. One is Mudha, that is a mad person or idiotic mind, which we also have many times. Kshipta, that is active mind or hyperactive mind. Vikshipta, that means partly active, partly inactive. Sometimes works like a good person, sometimes you never know. Ekagra, focused mind, and Mukta is free and liberated mind. So Ekagra mind is our goal, and Mukta, sorry, Eka mind is something that we should always be in, and Mukta, free and liberated mind, should be our goal of our life. So the disorders of Manovaha Srotas come from our routine emotions of greed, anger, envy, pride, self-importance, ambition, competition, comparison, and they can affect our mind and cause deep-seated, unresolved emotions and cause imbalances. So mind is something that we can control, and that is controlled through yogic Ashtanga yoga. We learn to do the different kinds, different limbs of yoga. Meditation is the seventh step. So to go to that step also, first we have to have control over our sensations. The best part is the tongue cannot taste itself, or the eyes cannot see themselves, or the ear cannot hear themselves, but the mind can look inside also and outside also. We can think what the other person is thinking, but at the same time our job is to think what we are thinking. So that's the beauty of mind. And so a person who has healthy mind is should look at himself or herself with judgment rather than looking at the others. And through Ayurveda and yoga, this is like a big thing is explained how and why and when we should be doing the practices to control our mind. So the causes are mostly the external causes, excess desire, excess grief, fear, anger, confusion, suppressing of feelings. Many products like caffeine, steroids, alcohol, marijuana, other stimulants, vata-based emotions, fears, anxiety, nervousness, sadness, pitta-based irritation, hatred, jealousy, pride, ambition, competition, self-importance, and kapha-based greed, possessiveness, confusion, and attaching to maybe materialistic things or people. So negative thinking, inappropriate inquiries, emotional confusion, lack of clarity, indecisiveness, poor concentration, ADD, which is a very high, I would say we have that issue in the US, in adults, including in child and adults, Alzheimer's, memory loss, lack of understanding, having no purpose of our depression, different types of depressions, are the signs and symptoms of Manovaha Srotas Drishti. This Manovaha Srotas Drishti can affect all the other Srotas, and all the Srotas can affect the Manovaha Srotas. So, we exceeded a little bit, but now I need everyone to talk to me because I'm not able to see you, and tell me if you have any questions.
Just a confirmation on the food, Dr. Veena. Like,
Sorry?
so if we were to eat prepared food, the older the food is, like say we buy hummus in the store that's already prepared. So if we don't know how many days old it's already been prepared, so it's already a heavy food because it's prepared.
So what is your question?
When in regards to food, if something's already prepared but it's fresh and it's store bought, then that would be a heavy food right before we even open it, right? Because it's
yes. There are few things. See, this is a big chapter that we can keep on listening. What I want to conclude in small time, short thing is, it depends on what exactly the food is. Okay, certain foods have good shelf life and certain don't. Just like I said, if you prepare a rice today or a pasta dish today, and if you put it in the fridge for 3-4 days, then no matter how wonderful it is tasting, the qualities according to Ayurveda have been reduced. There is no nourishment. It is just the earth element or the basic filling thing you're taking. You don't get any sattva or energy from that. That is inertia, that is tamas, that is heavy, guru. And so it becomes heavier in digestion for the stomach to digest than what it was on day one. But there are certain items that have a good shelf life originally, not because they are refrigerated. Okay, so for instance, when we bring a fruit, when we bring an apple or a banana, if we keep them out for 4-5 days, they are good, so you can have them. Or if anything that you prepare and that can sustain at room temperature, can be remain good at room temperature, that is the best food you should have. But for example, now you have hummus, which is prepared in the store. Maybe if you see hummus or wok, they have lesser shelf life than the frozen items. They are good for maybe a week, so hummus, it will be, if you see a hummus, they must have prepared it today and it is good for the next 7 days only. Okay, so try to eat it as early as possible. The best way, if you see idealistically, it's practically not possible to incorporate those principles 100%, but there is always a better option for that. So certain food items can remain good, and we are blessed many times to have cold weather as it is. So the food stays better in the room temperature also many times. But to answer your question, according to the Ayurvedic perspective, no, it does lower your Agni.
Thank you.
Okay.
Thank you.
Now, if we buy frozen vegetables, right? So we can take out a little and cook it for the day, and that's good.
I would say that instead of frozen vegetables, bring refrigerated vegetables. So there is a difference between refrigeration and freezer. So frozen items are already dead items. They are frozen for months together. But refrigerated items, if you go in the refrigerated section in any of your food health food stores, that is the shelf life is only for a couple days, few days. So they are much more fresh than the frozen items. Got it?
Yeah.
So the first step would be shift yourself from frozen section to refrigerated one, and then from the refrigerated one to just a day one. Like, I cook today and I eat tomorrow morning. That's it.
All right.
That should be the ideal way one should come from cooking Sunday or for the whole bowl or maybe a casserole of things. Slowly coming to the keeping a realistic goal. Because if I tell you the Ayurvedic way of eating food, I think you will just say goodbye to me right away.
That was only possible when I lived in my mother's house, because we had fresh food every day. But that wasn't it.
Because your mother or even my mother that was their prime job.
Yes, but here it is impossible.
Well, I won't say it is impossible, but maybe we can have that talk next time. I can talk about it in more details, that how we can have a better option in what we have today.
All right.
So what are the items that they are available in the store? They are available, but we need to just change our paradigm towards looking at things. So it's more of a grocery shopping and pantry setup than getting stressed out that I don't have time to cook. So it's more of an approach that you look at things that are available, and it can be doable. I wouldn't say that it's easy, but instead of getting stressed out by going to the doctors or paying for the vitamins, it's better to get stressed out by cooking.
Thank you.
Okay.
Okay.
So Renee, are we good?
I think Susan, did you have a question that didn't get answered?
Yeah, it was a question. It was a question that was on the test for this chapter that I can't figure out. And you brought it up,
Sure.
Dr. Bina, very quickly, which was the Muda mind.
You already
And-
have the test?
Yeah, we were supposed to take it by last weekend, I think.
It's a open book test.
Up you froze, I think.
Okay. So what was your question, Susan?
So it says, what is the Muda mind used for?
Well, Muda mind is idiotic mind, means where it has no logical explanation. Okay. And that doesn't mean there are qualities. Okay. Sometimes we think like an idiot, or sometimes our mind is so active, like we jump from one thought to the other. The mind, so only it's called as a monkey mind. We can change the phases. The mind has an impact of sattva, rajas, and tamas. These are nerves which play an important role in making our mind stable, and the doshas too. So in the morning, if your mind is for some reason is quite calm, stable, you start your day very quietly, firmly, with very optimism, and something happens through the day, and you have a good work, or someone talks to you, or you see someone's email, and then your mind starts rushing and it becomes active, hyperactive. So that vikshipta mind. Or sometimes you think, okay, am I doing it right? I think you take good decisions. Sometimes you do wrong decisions. So these are the phases or the stages of mind which we go through. So answering your question once again, can you repeat the question?
Yeah, it was a question in the test. It just says Muda mind is used for. What is it used for?
What are the options?
I can't remember what the options were. I was trying to figure that out because it won't.
The proper answer is liberation, but it doesn't say it in the book.
I was going to say contemplation, but liberation sounds good.
Liberation?
We're going to change that.
Oh, no. It's a mukta mind. That's what I was saying.
Yeah, that's
Muda
not that
mind. How can you use Muda mind for? Muda mind is idiotic mind. You cannot use an idiotic mind. You have to know Mukta mind. Mukta means free. Okay, so Mukta means free. So Mukta mind means what? Now there is in Dr. Lard's book only, there is a comparison he's made between the Muda mind and Mukta mind. So Mukta mind and Muda mind looks similar because both of the persons are happy for no reason, So one person is happy for no reason and one person is happy also for no reason. But you can feel the difference in both of them. One is a yogi and other is a mad person. So you can read that explanation. So Muda means, in Sanskrit, Muda means mad. And Mukta is free. So
liberated.
Liberated. Okay. And that is done through yogic disciplines. How a person attains disciplines, the yamas, the niyamas, the asanas, pranayam, pratyahara, dharana, dhyan, and then samadhi. So before samadhi, when you are in a meditative phase, you feel blissful. So having a blissful mind, it is the mukta mind, which is carefree, which doesn't have worry, or which is not affected by sorrows also, or which is not affected by someone praising or happiness also. It becomes stita prajna. That means it becomes stable.
Is this question 9 you are talking about?
Yeah, so that question then, Renee's not right because it says Muda mind and it should be Mukta mind.
If you go to page 194 in the book, because whenever I do these tests, I write down where I found it. If you look on page 194, you will understand it.
I didn't write the tests, so we're just trying to troubleshoot them.
I know. I see. I read it and I got it incorrect too, but then the answer was liberation. Then I went back and I read it in page 194.
Page 194?
Yeah.
Okay, we're gonna double check that.
You read it and see it, okay? And then we can discuss it again.
Of course.
Thank you.
Okay, so everyone, whoever has questions, I think I went very fast. This is a huge topic, but if you have any questions, feel free. I'll be open for answering through emails, hopefully on time, so you can answer your tests properly, okay?
Thank you,
Great.
Dr. Bina.
Thank you,
Okay,
Dr.
thank you. Namaste.
You
And
have,
have a wonderful
thank you
evening.
very much.
Thank
You
you.
take care. Okay, bye-bye.